I'm just going to check the doctor's orders so I could see if I have anything that I could do for you to help relieve how you're feeling. Okay, let me just check your chart. Here I see a doctor's order for, if client has not voided within 4 hours, use bladder scanner to check residual. If residual is greater than 200, then perform intermittent urinary catheterization. All right, so let me put this down, and I'm just going to check your chart for allergies. No known allergies. Okay. And let's see. Let me check the expiration date for the catheter tray, and it is August 2022, so it is not expired. All right, so that is good. And then your door is closed, but I am just going to pull this curtain. Okay, just in case anyone should come in, I want to give you some good privacy. And I'm going to just clean my hands. And will you give me your full name, please? And I would like to see your ID band. Perfect. And your date of birth. Okay, I'm just going to check that against your record. And I do have a Mary Smith with a date of birth of April 27th, 1976. Okay, Mrs. Smith, so what we're going to do today is we're going to do something called intermittent catheterization. So what that is it's going to be a little tiny tube that goes into your urinary hole, into the bladder, which is going to relieve you of that pain and pressure that you feel. And it's going to have your urine come out. Now what I'm going to do is I'm going to help you go into a more comfortable position for this. You can stay on your back the way you are, but we're going to have your legs bent up a bit towards your chest. I'm going to touch your perineal genital area just to cleanse you properly because we don't want to introduce any bacteria into your system. After I cleanse you properly, I will be wearing sterile gloves when I actually do the procedure. And as I said, we have a catheter which comes in that kit to your right that you see right there. In there I have all the contents that I need, and again, it's a sterile procedure, so don't worry about me introducing bacteria. We will be safe and careful along the way. I'm going to insert a tube. It's a little uncomfortable, but it's short-lived, and you will feel relief pretty soon after it is in your bladder. That tube's going to go in. I'm going to leave it in till you fully empty your bladder. Once the urine stops flowing, then I'll slowly take it out. Okay? Are you okay with that? All right, so let's get started. My hands are clean. I'm going to put on just regular gloves. This part is what we call a clean technique. It's not sterile yet. I will let you know when we get to the part of being sterile. Okay, I'm just making sure I have everything I need. I have all my supplies here. So, Mrs. Smith, I'm going to have you bend your knees towards your chest. Let me help you. Just bring your leg up, and you can let your leg fall out a little. Perfect. I'll help you with your right one. We're going to bend that knee up and just let your leg fall. Perfect. This shows me the area that I'm going to need to be working with. So what we're going to do is while you're there, I'm going to place just a little towel below. If you could just lift your buttocks up, I'll help you. I'm going to tuck this underneath. Great. Okay. Perfect. Okay, and now I am going to use these wipes. So I'm going to use one wipe, and you're now going to feel me touching you in your genital area. I'm going to hold open your labia, okay, and I'm going to use one wipe on the right side of the labia. I'm going to throw that into the garbage. I'm going to use another wipe on the outer left side of the labia. Throw that into the garbage, and I'm going to cleanse down the middle, clean the urethra, the meatus. Okay, and always going from front to back as I do that. Now I'm going to take my gloves off, inserting them one into another into the garbage. I will put these wipes away as we don't need them. I'm going to cleanse my hands. Okay. All right, and now I'm going to open our catheter kit, and I'm going to open the sterile side away from my body to keep the sterile field. I hope you could see this, Professor. but I'll verbalize everything I can in case you can't see it. So I'm opening this away from me, the first flap, and then the next. And I'm only touching the outside of this so it all remains sterile. And I'm just going to touch the outside of it, not touching the inside. And I'm going to place this below the patient. If you could just pick your buttocks up. Perfect. Okay. Good. And I'm just going to do a little cleansing of my hands. I'm going to now don my sterile gloves. So they are in an envelope over here. And I'm going to, with my non-dominant hand, I'm right-handed, so my left, pick up the right one from the inner side of it, because that side will be touching my hand. And I'm going to don that. And I'm not going to touch the band yet. Now, with my sterile hand, I'm going to pick up my non-dominant, my left hand, from the outside of the glove so I can maintain sterility. And I will do that. And now I can fix my cuffs from the outside, pulling them all the way down. Okay, I feel nice and comfortable with them on. All right, so now I'm going to take my kit. I'm going to bring it over, Mrs. Smith, by you. I'm going to toss that. We don't need that. Okay. I'm just going to take out what we don't need. Okay, so Mrs. Smith, you're going to feel me again. I'll be touching your genital area. With my non-dominant hand, I'm going to hold open the labia. So there I am, holding it open. I have now opened my swab sticks. Professor, I'm not really going to open them because I don't want to ruin the package if we need the kit again, but I'm going to verbalize what I'm doing. So I'm using the isopropyl alcohol swab sticks, or in most cases, I believe they use, starts with a B, but it's like a type of iodine. So I am going to use the swab stick, and again, we're going to go down the left labia, top to bottom, working our way towards the anus. Then on the other side, top to bottom, done. And then the last swab, top to bottom, covering the urethra. Okay. Now what I'm going to do is I'm going to take the catheter, and I have opened up a little bit of lubricant. I'm just going to lubricate the tip. And my right hand is still sterile, so notice I'm holding her labia open with my left hand. And I'm going to touch the inside of the canister because everything's sterile, just so it's closer to Mrs. Smith. The catheter tip, where the urine is going to come out of, is still within the container that's going to catch the urine. I am now going to insert the catheter. You're going to feel a little bit of pressure. Okay, take a nice deep breath. And I'm going to go just a little bit further, and now I see a little urine, so I'm going to proceed 1 to 2 inches. Okay, and I'm just going to hold this there. Okay. And we still have some urine flow. It's a nice clear yellow color. How are you doing, Mrs. Smith? Feeling better already? I'm so glad to hear. Almost done. It looks like your urine is starting to decrease. Okay, I'm going to slowly, you're going to feel me take this out. So now that the urine stopped, I'm going to withdraw. Okay, I'm going to take this. I'm going to document the amount. And we have 400 mLs of urine, as we saw in the bladder scan. And I'm going to put this into the garbage. And Mrs. Smith, I'm just going to throw that away. I'm going to just wipe off the iodine from you, and we can take this out. I am going to actually use this sheet and just give you a little bit of privacy over you. I'm going to just take these gloves off, put them into the trash, and a little bit of hand hygiene. And now we need to document everything that we did today. So I'm going to get my chart, and I'm going to document the procedure, the amount of what we did, and that Mrs. Smith tolerated it very well. And we will make the doctor aware. All right, Mrs. Smith, I'm going to help you into a more comfortable position, and I'll get you your call bell before I go and anything else you should need. All right?